With us rush to get tested, we are seeing more young people and kids testing positive. Data from the American Association of Pediatrics showing there were almost 200,000 new pediatric cases the week of Christmas. And most of those kids heading back to school next week. WCNC Charlotte's Chloe Leshner is live for us at StarMed's Tuckasegee Road Testing and Vaccine Clinic. Chloe, what do parents need to know here?
Hey, Vanessa. Well, Health Director Gibby Harris said that there are no plans to delay the start of school for CMS students, but the district will be sending out some guidance over the weekend, so something for them to look out for. Otherwise, I spoke to a pediatrician today, and she says the classroom still is the safest place for students to learn as long as there are some safety measures in place. And since every child will not be vaccinated, masking will be important. Next week, kids will head back into the classroom with stories about winter break activities or travels. But while they were away, Omicron became the dominant COVID strain.
Definitely there is an uptake of COVID in pediatrics in general.
Dr. Vrushali Patwardhan is a pediatrician with Novant Health. She says most kids who test positive have mild symptoms and recover quickly. And despite the growing number of pediatric cases, the classroom can still be a safe space if there are layers of protection in place.
I think masking is hands down most important thing that we can do.
A handful of districts in the area have plans to start back with optional masking. Many are revisiting their policies in the new year. Doctors say someone with Omicron will typically spread it to 3 to 5 others around them, so COVID shots will give more reliable coverage. In North Carolina, 20% of kids ages 5 to 11 are at least partially vaccinated, and 46% of 12 to 17-year-olds have gotten one shot.
And you're going back to school, you're going to share germs, how much ever careful you are. Kids are going to run around, they're going to be huffing and puffing. So masks, you're going to eat cafeteria, how much careful you are, the masks are going to come down. So vaccination, you have a lot more control with infection control with vaccination.
And as far as testing goes, she doesn't think parents need to go out and get their kids tested just because they're going back to school, unless they are experiencing symptoms or if they've been exposed to somebody who has tested positive. Otherwise, the state does plan to update its Safe Schools Toolkit next week. Live in Charlotte, Chloe Leshner, WCNC Charlotte.